Understanding Diabetes, a simple guide. Hello and welcome. Today, we're going to talk about diabetes, a common health condition that affects how your body handles sugar. On average, as per the International Diabetes Federation, 1 in 10 people in the world is affected by diabetes. Alarming figures. Don't worry, we'll keep things simple and easy to understand. Do you know that all diabetes is not the same? Does every diabetes person need medications? Are medications and plans to treat diabetes personalized? This video will answer these and other common queries that come to mind repeatedly. Noticeably, these are authentic pieces of information regarding diabetes, so you are on the right side to get knowledge about diabetes. References are available at the end of this presentation. Diabetes is a condition where your body has trouble managing sugar or glucose in your blood. This happens because of problems with a hormone called insulin. Insulin helps move sugar from your blood into your body's cells, where it's used for energy. When this process doesn't work correctly, sugar builds up in your blood, leading to diabetes. The inability of insulin in the blood to function properly will lead to this situation, which is called insulin resistance. There are a few different types of diabetes. Type 1 diabetes usually starts in children or young adults. The body's immune system attacks the cells that make insulin, so the body can't produce enough insulin. Usually affects children and teenagers. Type 2 diabetes is the most common type. The body doesn't use insulin well, or it doesn't make enough insulin. It's often linked to being overweight and not getting enough physical activity. Insulin resistance is the main culprit for this condition. Gestational diabetes happens during pregnancy and usually goes away after the baby is born. However, it increases the risk of developing type 2 diabetes later in life. Fourth type of diabetes is caused by other systemic diseases such as thyroid hormone derangement, cortisol imbalance, and exogenous steroid intake due to any other medical condition. Alright, let's dive into recognizing diabetes symptoms. Diabetes can cause a variety of symptoms, and some folks might not notice any symptoms at all. But some common signs to keep an eye out for include feeling very thirsty, urinating often, and feeling really hungry. You might also feel quite tired, experience blurry vision, notice slow healing cuts or bruises, or even feel tingling or numbness in your hands or feet. If you start noticing these symptoms, it's really important to talk to your doctor. It's always better to be safe and get checked out. Now, when it comes to diagnosing diabetes, doctors have a few tests up their sleeves. First up, the fasting blood sugar test, which measures your blood sugar after you haven't eaten for at least 8 hours. A typical result is less than 100 milligrams per deciliter. Pre-diabetes ranges from 100 to 125, and diabetes is 126 or higher. These tests need to be reconfirmed with further testing to make a confirmed diagnosis. Then there's the A1C test, which gives a picture of your average blood sugar over the past 3 to 4 months. A normal level is below 5.7%, prediabetes is 5.7 to 6.4%, and diabetes is 6.4% or higher. Lastly, we have the oral glucose tolerance test. After drinking a sweet liquid, your blood sugar is tested over a few hours. Normal is less than 140 milligrams per deciliter. Prediabetes is 140 to 199, and diabetes is 200 or higher. As we know, understanding our blood group is essential. We also must know our diabetes status and get an update regularly so we can act as soon as possible. It's all about getting a clear picture of your health, Managing diabetes involves several key steps. First, healthy eating. Focus on a balanced diet with plenty of vegetables, whole grains, lean proteins, and healthy fats. No fancy or shortcut diets usually help in the long run. It's important to limit sugary foods and drinks. Second, physical activity. Aim for at least 150 minutes of moderate exercise each week, like walking or swimming. Third, monitoring blood sugar. Regularly check your blood sugar levels to ensure they're within your target range. Fourth, medications. Some people may need insulin or other medications to help control their blood sugar. And finally, regular checkups. Visit your healthcare provider regularly to monitor your condition and adjust your treatment plan as needed. The frequency of blood sugar checks depends on your treatment plan. If you take insulin, you may need to check your blood sugar several times a day. If you don't take insulin, you might not need to check as often. Your doctor will guide you on the best schedule. These are the most common organs affected by uncontrolled diabetes. If not managed well, they can lead to serious health problems. For instance, there's an increased risk of heart disease, including heart attacks and strokes. Then there's kidney disease, which can damage the kidneys and potentially lead to kidney failure. Eye problems are also a concern, ranging from vision loss to blindness. Nerve damage is another complication, causing pain, tingling, or loss of feeling, especially in the feet. And of course, we can't forget about foot issues. Poor circulation and nerve damage can lead to some really serious foot problems. Regular checkups and good diabetes management can help prevent these complications. Diabetes is a manageable condition. With the right care, you can lead a healthy and active life. Remember to eat well, stay active, monitor your blood sugar, and keep in touch with your healthcare team. Managing diabetes effectively involves a multifaceted approach, and diet plays a crucial role in this journey. A balanced diet can help you maintain stable blood sugar levels, which is essential in preventing complications. Here are some tips on healthy eating habits for managing diabetes. First, focus on portion control. Eating smaller, more frequent meals can help prevent spikes and drops in blood sugar. Use measuring cups or a food scale to ensure you're eating the right amounts. Next, prioritize whole foods over processed ones. Fresh fruits, vegetables, whole grains, and lean proteins should make up the bulk of your diet. These foods provide essential nutrients and help maintain steady blood glucose levels. Another tip is to include fiber-rich foods. Fiber slows down the absorption of sugar, preventing sudden spikes in blood sugar levels. Beans, lentils, and whole grains are excellent sources of fiber. Pay attention to carbohydrate intake. Carbs have the most significant impact on blood sugar, so choose complex carbohydrates like whole grains and avoid simple sugars found in sweets and sugary drinks. Don't forget the importance of hydration. Drinking plenty of water helps your body manage blood sugar levels more effectively. Avoid sugary drinks and opt for water, herbal teas, or other low-calorie beverages. Lastly, balance your meals. Combine carbohydrates with proteins and fats to slow down the absorption of sugar into your bloodstream. This helps keep your blood sugar levels more stable. By adopting these healthy eating habits, you can take a significant step towards managing your diabetes and improving your overall well-being. Remember, it's always best to consult with a healthcare provider or a dietitian to tailor a diet plan that suits your individual needs. Every step counts towards better health. Another very important and often neglected part of diabetes management is feeling stressed and anxious for being diabetic. So efforts should be made to recognize psychological challenges early and managing it as efficiently as blood glucose. The impact of diabetes on mental health can be profound, and addressing this aspect is crucial for overall well-being. Diabetes can lead to feelings of stress, anxiety, and depression. The constant need to monitor blood sugar levels, adhere to a strict diet, and manage medications can be overwhelming. It's normal to feel frustrated or discouraged at times. Recognizing these feelings is the first step towards managing them effectively. Stress management is vital in diabetes care. High stress levels can negatively affect blood sugar control, making it harder to manage diabetes. Techniques such as mindfulness, meditation, and deep breathing exercises can help reduce stress. Regular physical activity, as mentioned earlier, also plays a significant role in stress reduction. Support systems are equally important. Connecting with others who understand what you're going through can provide emotional support and practical advice. Support groups, whether in person or online, can be a valuable resource. Friends and family can also offer support, but it's essential to communicate your needs and feelings with them. Seeking professional help is another critical aspect. Mental health professionals can provide strategies and therapies to cope with the emotional burden of diabetes. Cognitive behavioral therapy, CBT for instance, has been shown to be effective in managing diabetes-related distress. Remember, taking care of your mental health is just as important as managing your physical health. By addressing both, you can achieve a more balanced and fulfilling life while living with diabetes. Always have a plan in place for managing your diabetes during travel or unexpected events. Remember, managing diabetes is a marathon, not a sprint. Stay informed, stay proactive, and most importantly, stay positive. Like and subscribe for more regular authenticated videos. Thanks and have a happy, healthy life. Images used in this video are all AI generated.